Our topic for today is Advance Directives. So, Advance Directives, very important part of our nursing care. It is a legal document that gives instruction to the doctor and to the other healthcare provider as to what are the wishes of the patient in case they are incapacitated to make decisions. So, as a nurse, what are our responsibilities? And how do we integrate it to the plan of care of the patient? First responsibility is to identify if there's an existing advanced directives. As soon as we make contact with the patient, first assessment is one of the questions that we have to ask the patient. This is based on the law. It says based on the law, Patient Self-Determination Act, that gives the patient the right to decide on what's going to happen to them, even in the time that they will not be able to make decisions for themselves. So there are two types. So one is living will. This itemizes or specifies what are the instructions of the patient to the doctor. And this also specify what are the medical treatment that they want to receive. Next is the durable power of attorney for healthcare. It means names your healthcare proxy. These are the people who will make this is a person that will make decisions for you in case when you reach that point that you cannot decide for your own healthcare. So other advanced care planning forms and orders that you will encounter. One is DNR, do not resuscitate, meaning the patient doesn't want to receive CPR. But it doesn't mean that they cannot be intubated or they cannot be hospitalized. They just don't want to receive the CPR for whatever reason. Do not intubate, meaning they don't want to be invasively intubated, but they can still use non-invasive form of respiratory assistance like the BiPAP. Do not hospitalize, meaning some patients doesn't want to be admitted to the hospital, but they can still be sent to the hospital for emergency treatment. They stay in the emergency room only. Next, out of the hospital DNR order. So if anything happens to them while they're outside the hospital, they're in their house or wherever they are, they have cardiac arrest. These people doesn't want to be resuscitated. Next is physician orders for life-sustaining treatment, and medical orders for life-sustaining treatment will be discussed later. What are your roles? Number one is communication. Communication with the patient, with the healthcare team about the advanced directives. If there's an existing one. If the patient doesn't know about advanced directives, you may educate them and their family as well. On admission, determine if an advanced directive exists. Ensure that the healthcare provider are aware of the advanced directives. Not only the healthcare provider, but all health workers needed to follow the directions in that document. May vary from state to state, but nurses may or may not witness this legal document. So ethical and legal consideration for adults. It says what are the requirements like are they allowed to consent? They can make Are they allowed to make decision like patient is altered mental status or has altered mental status, and they will decide like I don't want to be resuscitated. Is that valid? Next is pediatrics. So you might encounter this that, say for example, the patient came in, they are 17 or he or she is 17 years old and want to make decisions for his or her healthcare. Are they allowed? So in this may vary from state to state again. In New York, if you are or if a minor is as a child or children, they are allowed to make decision or consents. If they are married, they can also make their own decision. And if they're living on their own, they're independent, and they can prove it, they can make decisions. For those developmental disabilities, if they don't have any relatives or no surrogate who can decide for them, even the healthcare provider, two healthcare providers can make decisions for them. Most for this one includes the following: resuscitation preferences. If you look on the right side, tells you this. This is an example of most form for New York State. Tells the information of the doctor, the patient, what kind of advance directives do they have. Do they have living will, healthcare proxy, any organ donation? This makes it easier for everybody in case of an emergency. Next is the resuscitation instruction or preference. Do they want CPR or DNR? DNR, sometimes they call it allow natural death. Next is future hospitalization transfer. Do they want to be admitted to the hospital, or do they refuse to be sent to the hospital? So there are options that are very specific. Feeding tubes. Do they want feeding tubes or not? Antibiotics. Do they want antibiotics or not? Dialysis or not to dialyze? And other instructions. And this document, according to law, should be reviewed 90 days. If not reviewed, then the first MOST will stand. It will be valid. For those who have developmental disability, it must be renewed every 60 days. And the availability of this, mostly it may be available online. There are database that the physician can access it, so that it can be carried from one place to another, one hospital to another. So basically, it's very important to communicate this every time we transfer the patient from nursing home to hospital back to the nursing home or other facilities where the patient is going. So, as a summary, advanced directives must be present so that it will not delay the treatment, and it gives clarity or good communication to everyone as to what are the wishes of the patient. Because sometimes you will encounter this. Say, for example, your nursing assistant doesn't know that the patient is a DNR, and suddenly the patient dropped on the floor, had a cardiac arrest, and out of panic, the trained nursing care assistant just applied CPR. So as a nurse, you will be liable for that because the nursing assistant is still under your license, under your responsibility. It does happen. So the only way to avoid this is to have a clear communication to everyone. So every time you hand off the patient to another nurse, you have to tell them, especially if they are unstable, you have to tell them about the code status of the patient. Is the patient DNR or not, DNI or not? And next is communicate with the healthcare provider that they have to review every time there's a change in the patient's condition. The code status must be reviewed. So that's it for advanced care.